Hi, I'm Allison, and this is Emily, and today I'm Emily's physical therapist, and I'm going to take her through the Astrand rhyming protocol test so that we can estimate her VO2 max. So right now, Emily's been warming up for around 2 minutes, and she's been doing this at 25 watts and 50 rotations per minute. So now I'm going to bump her up to 100 watts, and she's going to maintain that 50 rotations per minute so that we can get her started on the testing. Okay, so Emily's going to be doing this for 4 more minutes, 6 minutes. And after 2 minutes, I'm going to test her to see if she's in her submaximal range. She's going to continue the test for 3 more minutes, and we're going to test her again, just to make sure that she's responding appropriately to exercise. And after that 6th minute, we're going to test her to see if she's within 5 beats per minute of her first heart rate. So before Emily came in today, we tested her heart rate, her blood pressure, and her rate of perceived exertion at baseline. So her heart rate was 91 beats per minute, which is a little high for someone her age, but it's under the 100 beats per minute. So she's in a good starting area. And her blood pressure was 116 over 78 millimeters of mercury, so she's good on the blood pressure too. And then her rate of perceived exertion was at a 6. So she's okay to start testing. So we also figured out what Emily's rank would be so that we could test her appropriate workload. So she's a conditioned female, so we put her at 100 watts. And then we've also assessed Emily's cardiovascular risk assessment, and she is in the low category, so all good signs. Okay, so that's been about 2 minutes. So now I'm going to test her heart rate and blood pressure, and we're going to see if she's in her submax range. What would you say your RPE is right now?
About a 10.
Okay, so Emily's RPE is pretty standard. It's increasing as the workload's increasing, and then her heart rate was about 132 beats per minute, which is within her submax range of 115 to 163. And then her blood pressure was also increasing normally. So I'm going to have Emily continue this for just 2 or 3 more minutes, and then we can test her one more time to see if she is still responding normally to exercise in that submax range still. And then at the 6th minute, like I said earlier, we'll test her again just to see if she's within 5 beats per minute. So how are you feeling, Emily?
Tired.
Yeah, doing pretty well. Seeing out that good rotations per minute.
I blame my high heart rate on my practical I just took.
Yeah, Emily just completed her final anatomy practical, so excited about that. So responding well. looks like we just have 1 more minute left before we test at that 5th minute. And then we can see if she's still in that range. Are you ready for break, Emily?
Yeah, so ready for break. Not the crowds in the airport, but it'll be fun.
Oh, it's fun. Alright, so looks like we're about there, so I'm going to test your heart rate and blood pressure one more time. So Emily's heart rate is still in that submax range. She was about 140 that time. And so it looks like we're coming up on that 6th minute again. So we'll test her one last time. And if she's within the 5 beats per minute this time, then we can stop the test and call it good on the protocol. And what was your RPE that last time?
13.
Blood pressure is still responding well. And now heart rate. So Emily's heart rate was 143 that time, which is under the 5 minutes or 5 beats per minute. So I'm going to have her decrease the wattage to 25 again, and she's going to do a cool down for 2 to 3 minutes.